President Obama's healthcare law will cut the number of full-time workers by 2.3 million by the year 2021, and it's going to ensure 2 million fewer people than expected. Those are the new numbers out this morning. Welcome to your Tuesday lunch break. I'm Sarah Murray. A new nonpartisan Congressional Budget Office report saying technical problems with implementing Obamacare are taking a toll, discouraging workers from signing up for new plans. Joining us with the latest, WSJ health policy reporter Louise Radnofsky. Hi, Louise.
Thanks for having me.
Thanks for being here. Okay, so this drop in full-time workers is a little bit tricky to understand. Why don't you explain what's behind it?
Well, what CBO says is that a number of different things are going to happen to the labor force as a result of the health law, but one of them is that the number of hours worked by people overall is going to drop a little bit. This is primarily employers trimming workers to get some of them below the 30-hour-a-week threshold at which they have to provide coverage or pay a penalty. The net effect of that is that in 2021, you would see the equivalent of 2.3 million fewer people having full-time jobs, or the equivalent of them. That's really one way of assessing the cumulative effect of those hours and how they add up.
The other thing this report points out is overall 2 million fewer workers will be uninsured than they expected. Why is that the case?
Well, the number of uninsured, the number of people who were expected to gain insurance through the law in 2014 was always surprisingly low to people. Just 7 million people were going to be in the exchanges, according to an earlier CBO estimate. That's gone down to 6 million. And just 9 million more people were going to be in Medicaid. That's now gone down to 8 million for 2014 specifically because of the messy rollout of the law. And of course, as viewers remember, healthcare.gov had a lot of problems. Healthcare.gov was serving 36 states, and so it's clearly had an impact.
This report seems like it's just going to give Republicans even more ammunition to say that we should repeal Obamacare or it should have been delayed. Are we hearing anything from them yet?
Well, there's space for Democrats still to point to some of these things being reversible. They also actually got something in this report that will come as good news to them. Republicans are focusing their attention on risk corridor payments in budget negotiations. This is highly technical, but it's basically a scheme which reimburses insurers that end up with a sicker than average population, something insurers are worried about because they can't charge sick people more starting this year. What the report says is that actually the costs to the government of that program are not going to be big. That there could be a surplus in it, and so Republicans aren't going to have the kind of number they wanted to be able to point to about the government's liability for that particular provision. So that isn't going their way, but certainly in these other things, as you've noted, the effect of the hours cuts, the number of people who actually gained coverage in 2014, there's something for them to yell about.
All right, Louise, we're going to leave it there. Thanks for being with us.